Here's a girl, she's a star. She's got style. Steffi Star, you see her face around the town. She's popular. Steffi Star.
Hello, everyone. This is Stephanie Weinstein.
And I'm Meredith Keach.
This is The Show.
Podcast with Weinstein and Keach.
Yeah, podcast. Or what did someone say? It wasn't a podcast.
Oh, right. Yeah, what did he say? It was a vlog, Adam, or something?
Yeah.
We're a vlog.
It's changed.
It's changed.
Because you can watch us, so we're not quite. But you can listen to us and not watch us.
Yeah.
Or you can listen and watch.
Yeah.
Mm-hmm.
Well, today we are with some very exciting guests. Basically, they're like silent celebrities.
Yeah.
Because
They're very pretty.
they're very pretty. And
So nice.
what these ladies do have cult-like following, and it's like the underground. Like, you don't want to say you know them without a wink.
Wink and a nod.
So these are the ladies from Medical Aesthetics,
Mm-hmm.
Easton, Milton, and
Hingham.
Hingham.
Oh.
Amazing.
All three?
Lindsey, how do you pronounce the last name? Gillooly?
Gillooly.
Gillooly and
Yeah.
Allison Daly. Thank you
Mhm.
for joining us today.
Thanks for having us.
So
Thank you
fun.
for having us. So
I think
fun.
my sister-in-law went to you.
You're not supposed to say that.
We can't
You're
disclose
outing her.
this.
Oh.
I have no idea. I have no
We have
recollection
no
or knowledge of that.
That was like when I got my eyes done and I sat down at the doctor. I'm like, do you know so-and-so and so-and-so? They said you did their eyes. She goes, maybe I did and maybe I didn't.
Right?
Oh,
And that's how you knew she was good. Mm-hmm. That's right.
exactly.
So usually we start the segment off with complaints that Stephanie has. She needs
Oh.
to get them off her chest.
I like that.
I know,
Let's do
but
it.
actually today I feel good.
Good.
I'm happy.
Yep.
I'm getting offers on my properties.
Mm.
But the most important thing has been my sleep.
Yeah.
Mm.
So I am menopausal
Mm.
and I haven't been sleeping.
Mm-hmm.
And a lot of people my age haven't been sleeping. Meredith K. Keach doesn't sleep either. So what happens is we get up, I fall asleep immediately, but then I get up at 2 or 3, and then I'm up the rest of the night. So now I have a new routine.
Okay.
So I've been taking 100% pure melatonin.
Good job.
Okay.
Okay, so I've been taking that. Then I've been taking magnesium.
Mm-hmm.
Then, and it's a powder that I drink in warm water.
Oh.
Then, and I got it for you. I don't know if you've been using it.
Yep.
The
I have.
magnesium spray
It's a little sticky.
that you spray on the bottom of your feet.
Yeah.
Hmm.
Spray, 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 spray.
It's
spray,
magnesium
spray,
and
spray.
salt.
Nice.
And
It helps.
I've been sleeping.
Wow.
Yes, I'm still waking up.
I think it might be a what's it called?
Little
when it's
placebo?
Like, thank you.
No, it's not.
Okay.
No.
Not the melatonin. Magnesium.
I don't know. It's helping. What was I taking before that I said I found the Holy Grail?
Benzos.
My friend gave me a half of, what was it?
Xanax.
Oh, yeah. He goes, he's like, take this. Just take a half.
Oh, yeah.
I'm like, I go, okay. He goes, you're going to take it and you're going to wake up. In the middle of the night, you're going to look at your phone. You're not going to care and you're going to go back to sleep. I said, okay. I go, this is so exciting. So I took the half of Xanny. I went to sleep. I woke up. I looked at my phone. I had no thoughts.
Nothing.
There was
Blank slate.
Nothing.
Mm-hmm.
It was like I didn't even exist.
Mm.
It was like I had no life.
Yeah.
I went back to sleep. I slept. I woke up. I was in the best mood ever.
Huh.
0 complaints. I go to work. I say, I found it. I found the Holy Grail. I'm going to sleep. And then I told Meredith, and then she squashed it. And that was it. I haven't taken one since. So that's it. So I just wanted to
That's
report
a good
that
friend,
I'm
Meredith.
right.
That's a good friend.
Back to magnesium.
Back to magnesium.
Back to magnesium.
On
I
our
went.
palms and our souls.
Exactly. And I'm not sure she's thrilled with the melatonin, but let's not talk about what stuff you're on. So let's just keep going, girls. Let's talk about you.
Well, you know what? Sleep is a big thing, though. I'm sure that radiates out into your world.
Mm.
Skincare, you can see it, right?
Sleep is so important. Oh my God.
We need it.
Yes, we do.
Wait, is it bad if I go tanning?
Oh, like in a tanning bed or a spray
Lindsey.
tan?
No.
She can't even catch her breath right now.
Full tanning bed, level 5.
Oh.
High voltage bulbs.
Oh.
7 to 12 minutes a crack.
All right. So are we saying, is this good for our mood or our skin?
Well, I mean, I'm not going to lie. I think my skin's pretty good.
Mm-hmm.
You
Your
have
skin's
good-
beautiful.
You have really good genetics.
I have good genetics.
Mm-hmm.
My mother had no wrinkles.
Yeah.
Mm-hmm.
If you like the heat, those infrared saunas
Oh, yeah.
would be a good option.
Yeah. No, I like to be tan.
So what happens when you use a tanning bed?
So it's melanoma, basically.
Cancer.
It's like,
Yeah.
yeah. So the rays that you're getting are high dosed in a really small period of time.
Okay.
So it's just increasing your risk of melanoma. I read a study. I
What
almost
about
think
the
it was like
sun?
sevenfold, but I'm not. I don't
What
wanna be
about the
quoted on
sun that we lay out for hours and hours and hours?
Sunscreen, but then again, you need a little vitamin D. We live in New England, so everyone should be taking a vitamin D when it's not sunny so that you can at least absorb your calcium, especially if we're talking about heading into menopause. But you need a little bit of sunscreen on you too, especially with zinc. Just, you can get a little bit of your melanin up and your mood up, but the cancer causing part and then the lines that form. That's why people, if you see those studies of truck drivers and the left side of their body from the sun every single day of their life on one side of their body. Those studies are unbelievable for just sun protection.
We see that consistently in the office.
Consistently, the left side of someone's face needs either more Botox or more microneedling or more
IPL.
attention with IPL. To help remove the brown spots. So it's really fascinating when you see the difference side to side.
No brown spots on Stephanie.
None.
I'm not going to brag, but
None.
it's no brown spots
No.
here, girls.
You have gorgeous skin. You're not helping the cause I'm preaching right now.
Sorry.
I do not go in a tanning bed, FYI. So I'm on your
Meredith,
program.
you have gone tanning.
I have, no question, but I don't regularly.
No,
it
you
was
don't.
part of my sad program,
Right.
coming out of January and February.
That's why I said for
Right.
your
Yeah.
mood,
Yeah.
I
Right.
totally understand,
Yeah.
right?
Yeah.
But then now they have those salt lamps
Oh,
and
yeah.
bright lights
Right.
and red light
Yes.
therapy. And if you love the glow,
Yeah.
have you had a good spray tan?
I did.
They can be
I love the
great.
spray tan. I look so hot with a
Right?
spray tan.
And 0 rays,
Right.
0 melanoma risk.
I know, but then it goes away
Well, I don't
after a
have
couple days.
Stephanie's skin, though. So that's why I was like, Keach, you got to find another program
Yeah.
to uplift your mood.
Yeah.
Because I'd get it. You wouldn't.
Right. That's true.
Yeah.
And
So-
wrinkles.
Yeah. You don't have any wrinkles.
You don't.
No, but if I was in the tanning bed, I would.
Oh, right.
Mhm.
Yeah.
Mhm.
I don't know.
Yeah.
So,
Okay. Let's talk about vaginal rejuvenation.
Oh, I love that we just dove right
Adam,
into
are we
that.
allowed to talk about that?
It's a medical procedure.
Absolutely.
talked about it on the show.
Yeah, absolutely. He's already heard this spiel.
Oh.
Old news for Adam.
This is so exciting. Does anyone call it anything else? Do you have to say the full name?
You can call it the O shot.
Oh, the O shot.
Yeah.
What?
Yeah.
The O shot.
Mhm. Yes. So
Oh my
certified
God.
O shot provider.
Okay.
So it is exactly what you would think by the term. Dr. Runnels coined this term, the O shot. It's PRP, which is platelet-rich plasma. So someone comes in, we draw their blood. We use it for joint injections as well. So Lindsey has an ortho background, so she'll do a lot of PRP in knees.
What's PRP?
Platelet-rich plasma. So it's when we draw your blood, spin it down, and
Yep.
we use only the plasma.
Is that like plasmapheresis?
So it's basically it's your cytokines and growth factors in this beautiful kind of yellow liquid gold solution that comes from you. You can use it so many ways. We use it for hair restoration. We use it for facial rejuvenation, vaginal rejuvenation, joint injection. So the reason is it's helping your blood flow to the area, and it's helping to produce more collagen. Your epithelial cells change. They've done biopsies pre and post. So when it's done vaginally, you're getting better lubrication. You're getting the skin in the vaginal wall to actually be tighter for people who might have had children or for people who might have urinary leaking. So it's awesome and no side effects of like hormone therapy.
Right,
so you
'cause
think
you're
about like
right.
your cancer survivors or your
Yes.
people with high blood pressure who can't take hormones.
Mhm.
So it's a wonderful option. I know. Simple procedure, 30 minutes.
So you could use it for ligament, a little boost for that if you've got some injury.
It's really good for arthritic patients. So it basically dysregulates the swelling cascade that we have when we have deteriorating cartilage, right, which is essentially what is arthritis. And the worst stage when you need a joint replacement is stage 4, and that usually means it's bone on bone. So your bone is now hitting bone on the other side, and it articulates with no cushion in between. So unfortunately, PRP doesn't help that to regrow, but what it does is it makes the body stop that constant swelling. It's the swelling over and over that's actually causing the pain for those patients. Yeah. So that's an interesting, it's an interesting concept to understand that. But as far as like the treatment, it would be maybe 1 a month for 3 months. And we've seen really good success with that. A lot of orthopedic surgeons are referring their patients out for it. It's not a cure, like I said, but it just definitely helps with the pain.
Gives a little it takes a little edge off. So with the swelling, would you pair it with like cold plunge or cold therapy?
Yeah, absolutely.
Sure.
Meredith K. Keach, doctor.
I want to do it. I don't really have any major
I
swelling.
want to do the RPR. Is that what it's called?
PRP.
I mean, that's me. I want to do the PRP.
That is what goes into the knee as well. Vagina, knee, face, scalp.
But you said something about hormone replacement.
Alternate.
Alternative or in conjunction. But if there's someone who can't take hormones, maybe they've gone through radiation or chemo, they had an estrogen positive tumor, they can't use hormones. So then for vaginal dryness and like a lot of discomfort, this is really all that we have.
Right. Right. Yeah, it's a side effect. When
So how
when
do
your
you
vagina dries up.
How do you do that?
So I actually once I take the plasma from the arm, it looks just like a tube of blood when you go to the doctors. That's it. It's not a crazy amount. We have a centrifuge. So we'll put that tube in a sterile environment into a centrifuge, and it spins high velocity 10 minutes. When it comes out, you see it separate. Whole blood's at the bottom, that's your red. Plasma's at the top. We extract the plasma, inject about 4 milliliters.
Does it hurt?
Where are
Not
you
the
injecting?
Anterior vaginal walls, the top of the vagina.
Does it
inside.
hurt?
Inside.
That does not hurt. Inside. So it's almost like an internal, well, it is an internal exam. And then the injection goes at the top. So you do not need a speculum.
Really? You can get that needle in there without it.
Yeah. And then 1 milliliter is clitoral. So that can be a little tender. So I do numb before that.
Okay.
Yeah. Little
I'm
numbing,
scared.
little ice. And then promotion of blood flow.
You've got to
zero
be brave
downtime.
to do this.
Honestly, people do great. I mean, so many of the people coming have had children.
Okay.
So they're all
used to it.
They're used to it.
Yeah.
And the majority of people know me,
Yeah.
trust me, have
Yeah.
a relationship with me. I also did OBGYN for almost 20 years.
Yeah.
So I've done
Seen one, you've seen them all.
exactly. Labor and delivery was what I did for a long time. So it just felt natural for me to incorporate this into an aesthetic practice, but because I'm an OSHOP provider, you can find our location by the website. So you do get some people who know about this and they'll search for you based on that, and they'll search for someone in their area.
Well, the discomfort they're probably having is so great that you kind of get over whatever your inhibitions are, I would imagine.
Exactly. You do a consult. We do this subjective questioning called the Female Sexual Health Dysfunction, and it's a questionnaire because it's subjective. So how do you evaluate if it works, right? So the way PRP works is it kind of peaks at about 3 months. So everyone comes back at 3 months, they fill out the same questionnaire, and we see if it helped them or not.
Oh, that's great.
Yeah, it's pretty cool. It's really cool.
I wonder if it hurts as much as when I went to the gynecologist. She inserted something in my body, which I've never had before, and then she decided to take a tissue sample.
Oh, Steph.
Without asking me.
Oh, boy.
She has since
awful.
left the country. She's gone.
Oh.
She's gone.
Is that the Loomis one?
Yeah.
Yeah, same. I had the same one, GYN. I have to track down my records. She just disappeared.
She disappeared.
Yeah.
Oh my goodness.
One day I went in, she goes, I'm not having a good day. She goes, I almost didn't come in. I'm like,
Wow.
aren't you supposed to be like talking to me about my stuff? I'm like, don't worry, doctor, you're going to be okay. Everything's going to be fine. I'm glad you came to work today. And you know what? And then next thing I know, she was taking a tissue sample and I was like, So I was wondering if it was the same pain.
Absolutely not. It sounds like you had an endometrial biopsy. It's nothing like
Excuse
that. That sounds awful.
I mean, the shit we have to go through.
Yeah.
Agreed.
Yeah.
Agreed.
Well, at least you numb a little.
I do. A little numb, little ice, a lot of laughter. Yeah.
Yeah, a lot of laughter, right? And preparation.
A lot of prep.
We don't
Mhm.
surprise anybody with that one.
No, everyone knows exactly what they're getting or not getting.
Right.
Holy.
Yeah. Wow.
Wow.
I'm
All right.
sorry that happened to you.
Oh, that's all right.
Yeah, it's a lot.
I've lived to talk about it.
You've lived to tell.
So I'm going to be very honest with you.
Thank God.
I'm scared of fillers.
Mm.
And all my friends get them.
Mm-hmm.
All of my friends get Botox and all of my friends get fillers and they look absolutely gorgeous. And I want to do something because there's some sagging going on here because I'm getting older, but I'm really scared of the fillers.
What
I'm
scares
scared.
you?
I'm scared that you're putting this foreign thing. I'm not like a big person into shots or any of that stuff. And I just like, what is it?
Mhm.
What are the fillers?
Mhm.
So there are different types of fillers, and they've come a long way in the past decade. At this point, we only use the fillers that are made of hyaluronic acid only. So hyaluronic acid is a synthetic version, so made in a lab,
Mm-hmm.
to match what we have as hyaluronic acid already in our skin. So it's a biologic, meaning that it mimics what we already have in our body. I'd say nobody has an adverse reaction to the actual product for the most part. It's usually about how it's injected before and after and during injection. Every part of it's so important to be done correctly. But the ones that we use, mainly Juvederm, everybody's heard of that one, and Restylane, right? Those are two.
I've heard of them.
Yeah. So it's clear gel, hyaluronic acid, lidocaine, and a pH buffer in a sterile syringe. That's all that's in it. If there's anything that you don't like about it, or if there's any kind of emergency, we can dissolve it. So we have an antidote in the office called hyaluronidase. You inject it, it dissolves it right away.
Like how? So like,
That's pretty
let's say
impressive.
like a month later, you could dissolve it.
Yes.
How long does it stay in?
So 12 to 24 months is how long they've been approved by the FDA. So you have some fillers that are really, really viscous, and we use those in parts of the face that need that, like lifting the cheeks, right? You have some that are really, really almost they're like
Silky.
silky.
Yeah.
Thin. We might use that in the perioral lines or the lips because they need to move. You don't want to feel like you have anything in your body that's foreign.
Right.
You know?
Right.
So their viscosity really dictates also their longevity, you know? And sometimes that also is like, wait, I don't want it to last that long. And then the minute they have it, they're like, I do want it to last that long.
Right.
I really do.
Right.
So, you know, so we work with that. And also when you think about a syringe of filler, what is that? They say it's like a blueberry, right? When you squirt it out of a syringe, that's all it is. It's a little blueberry. So it's really hard to be overdone with filler. It would take so many syringes in all the wrong places to make someone look unlike themselves. And that is no one's goal. Everyone who comes to see us, 99%, I don't want anyone to know I was here. Say, perfect. You know, so you just make someone feel more confident, better about how they look and feel, right? Better about aging.
Kind of like your eyes, I think.
I told everyone about my eyes.
Yeah.
See?
So I went to a Botox party. This was years ago. She's like, so all the girls were sitting down from our office, and she's like, they're like, you need Botox here and there and here. And then I sat down. She's like, you don't need Botox. And I'm like, oh, thank you. She goes, you need surgery. I had a heavy bag and a hood.
Okay.
Yeah. So I got that taken care of.
Well, good.
Blepharoplasty.
So she was really authentic
Yes.
and honest.
Yes.
She was.
That's great.
Where did you have that done?
In Boston.
Mass Eye and Ear?
Nope. Dr. Katrinka.
Mhm.
Oh, yeah, she's great.
Yeah.
Yeah.
Hey, her.
Oh.
Her last name is Heher.
Okay.
Yeah,
Okay.
Dr. Katrinka. She's like the best of Boston. She just does eyes in
Mhm.
Boston and Naples.
Mm-hmm.
And
That's
so it was
great.
great because I sat down and she's like, oh, yeah, you're going to love it.
Your eyes look great.
And she said, there's other
Yeah.
people that come in and, you know, I'm like, you're not going to get the results that you want. So I'm not going to do it. But yeah, but the next stop is fillers and Botox.
But I think, I mean, you used to talk about the bags in your eyes, which I didn't really notice, right? We're so self-critical. But that was something that you just really focused on.
I did.
And having the ability to just get rid of that problem is magical.
Right.
I mean, look at my son had a mole on the side of his nose. Not a big deal to us, right? Like big deal. But for him, it was a big deal. Even as a little boy, kids would comment about the mole on the side of his nose, or it was a mole. And I said, we'll get rid of it. And so I was talking to the plastic surgeon, and I said, well, what got you into this? It's pretty magical what you do. And he said his brother was born with some type of a deformity, and his parents wouldn't do anything about it because they said, just love yourself. You don't have to do anything. Just love yourself. And it was out of that where he was witness to that, something that bothered his brother his whole life, and it could just be taken care of. And there it is. It's done.
And there it is. I agree.
Like
That's a good reason to go into plastics.
Yeah.
Mm-hmm.
Really.
Body hair, you can get rid of body hair.
Get rid of body hair.
Exactly. I mean, think about what little girls and boys dealt with years ago before
Yes.
laser hair removal.
Right.
Kids can be cruel.
Right.
And now, I mean, you can laser someone really at the age of 14.
Yeah.
You might have some regrowth with
Right.
hormonal changes, but it's so safe and effective.
Yeah. Done.
Yeah, done.
Yeah.
I spent thousands of dollars on you know who. she came and she said, I don't like all this hair.
Yeah.
I said, well, the good news is we can get rid of it.
Yeah.
Mhm.
And I spent thousands.
Yeah. And it was worth it.
It was worth it.
It's worth
because
it.
it's a non-issue.
It's a non-issue, right? She's as happy as can be.
Yeah, exactly. So why do you have to go through that kind of ridicule?
Right.
You don't. You
Right.
don't. So, it's the same thing. I remember when I was thinking about going into this, and I have a little girl, and I said, Mom, am I a good example for my daughter? And she said, are you going to get her braces when her teeth are crooked? Are you going to color your hair when you go gray? I said, of course. She
Right.
said, how is Botox and filler any different?
Yeah.
Right.
You are helping someone feel more confident about
Yes.
who they are.
Yes.
I was like, good point. Let's
Yeah.
do
Right.
this.
Yeah.
Let's do
Although
this.
I do think if the world were going to collapse tomorrow, those of us who indulge in these types of services would age at a very fast rate.
Well, we saw that a little bit during COVID, didn't we?
Oh.
Didn't we? And I don't know about you guys, but I was still working in the hospital at that time too. And I thought that was cruel. There should have been a spa open for all first responders. Okay? There were daycares. What about a spa?
Right.
Yes.
Just something?
Right. Wow. I never thought of that.
Ooh, within 6 months, we'd all be looking a decade or so.
So is that how
older.
you have to go back every 6 months for Botox?
3 to
more
5.
frequently.
Oh, 3
yeah.
to 5.
Yeah. And the thing is, your rate of aging doesn't accelerate. People worry about that all the time. And, people are getting injected younger and younger. So a lot of the time it's
I've noticed
pre-baby.
that.
I
Yeah.
know. Let's
Right?
talk
Yeah.
about that.
Yeah. So,
Yeah,
I mean,
the
honestly,
20-somethings are doing it.
they're brilliant.
Yeah.
I don't think I would have had the money in my 20s.
Yep.
But if you can see genetically how
Yes.
you're going to age and you could prevent that 11
Yes.
from forming,
Yes.
why wouldn't you?
Yep.
Really?
It
Yep.
is such a small amount.
Yep.
It is so safe.
Yep.
And then it never happens, right? But people say, well, what do I do when I get pregnant? You stop.
Yeah.
It doesn't accelerate your aging. It's just for that period of time,
Yeah.
those muscles will start to work again.
Yeah.
Then when you're done breastfeeding, you come back to us and we resume.
Done.
So people don't just all of a sudden age when this starts to wear off. They've actually preserved for
Mhm.
however many years they've done it.
I've noticed that. I have this
Great.
line right here, and the Botox gets rid of it.
Exactly.
It was a crease, and my
Yeah.
mom has the same one. To
Yeah.
your point,
It's
Yeah.
genetics.
just get rid of
So
it.
how cool is that people can look? Where
Yeah.
before you'd be like, whew,
Yeah.
look what I have.
Well,
coming
my
at
kids
me.
had said to me one day, "Mommy, are you mad at me?"
Mm.
I said, "No, but it's time for Botox."
That is like the best story. I love that.
It's the best.
And
It's the best.
Yeah.
Mine say, Mommy, how come your forehead is flat and Daddy's goes like this? I said, go ask him. Go ask him. Please.
It's
we
so
need to get
awesome.
more men in the door. I mean, right?
right.
Yeah. We need to get more men in.
So tell us about some of the other services. So people after listening to this don't just think you do vaginal rejuvenation. What
Yes.
are and Botox? What are the other services? Do you have people just come in and say, "Give me a consult. What do I need?"
All
Yes.
the time. We have wonderful estheticians,
Mm-hmm.
laser technicians. So we do something as simple as a basic facial. We usually incorporate the machine, the hydrofacial, with almost all of our facials, which is nice. Then we have multiple lasers.
What do the lasers do?
Does that hurt?
It depends on which treatment it is.
If I get laser
Yeah.
on my face, does that mean my tan's going to go away?
We can't do laser on your face with a tan. So
Oh.
that's a prerequisite.
Oh, wait. Laser
Yes.
is. What does that do?
So we have different lasers. So we have the laser hair removal, right? So
Oh,
that's
right.
one type of
Okay.
laser.
Right.
Then there's another laser treatment. We use IPL, intense pulse light. It's not actually a laser, but we put it into the same category. And that's good for the brown spots or aging spots that we get with time, with sun, genetics, hormones. Usually that's 1 to 2 treatments, clears the skin. A lot of times I'll tell patients, let's focus on some of the easier, less expensive treatments and get you where we can be the best we can be with the least expense first, because a lot of patients come in very concerned about the money. And is this going to be a lifelong investment? Like,
Yes.
all this money every 3 months, and that's the thing. We're not just Botox. Like, we offer so much more, and we try to collaborate with the estheticians and laser technicians because there's so much that those treatments offer for what we're doing, which is the long-term anti-aging, rejuvenation, also just having healthier skin.
Yeah, so talk about that. But I need to inject about the finance piece of it, because after my first Botox, we're at Janine's house actually in Easton.
Oh, yeah.
There was a group of ladies there, and I said, I just got Botox for the first time. And my girlfriend said, now you need to budget for that. Because
you're never going to not do it.
You're never
again.
not going to do it.
And that was years and years ago.
And it's truth. But anyway, so let's talk about healthy skin, right? So a facial feels good. I had a hydrofacial last week. Love it. It's what my skin needed for sure.
She would have gone to you, but she was in Vegas.
Correct.
Next
it was
So fun.
Yeah.
Yeah.
I might have needed an IV.
Also fun.
Yes.
Yeah.
We do IVs
also-
during our
I
hydros.
saw that
you
on
do?
your
Yes.
website and was like,
There's so
wow.
many things.
Somebody
Yeah.
told me last weekend that would have been Stephanie and I were coincidentally there, no lie, at the same time in the same hotel.
My God.
I was on a birthday party and Stephanie was just on a trip with friends. And so, oh my God.
Let's
that a
just
fun
say
town
we
to
had
be.
a
Isn't
good
it?
time.
We'll be there
In
next
Vegas.
month.
Yep.
We have the American
At the
Medical
Wynn.
Spa Conference in Vegas.
Oh, you. Where
Yeah.
are you staying?
The Wynn.
Oh, we went to the Wynn, actually. Sebastian was there.
Oh,
That's
yeah,
where we
yeah,
saw
yeah.
Sebastian.
Sebastian
Yeah.
Maniscalco.
Have a
Ooh.
blast. Have a blast.
Great
So
show.
funny.
Yeah.
Yeah.
You
How
should try to
long?
see some shows.
4 nights.
During the week or
It's
weekend?
a Thursday to a Monday.
oh, that's
Oh,
what I did.
Yeah.
Thursday to Monday.
There
It's
you go.
so much fun. I only play cards once, by the way.
Yeah.
There's just, I hadn't been in 20 years. You guys have probably gone to this conference all the time, but there's so much to do. It's just an adult playground.
It
And
is.
the reason I needed the hydro was not from Kettle One necessarily. I mean, there was that too.
Wow.
But it was Red Bull, Starbucks, like, because you just want to stay up. There's more to do, more to see. So much fun. So on the heels of that, let's talk about healthy skin.
So I like to tell people, every 6 months, think about this. We go to the dentist for cleaning.
Yeah.
I
We
go
don't-
every 4, and
every
I just
4.
went today.
Nice.
Yeah.
Thank you.
And doesn't that feel great?
Yes.
Yeah, it's for hygiene and also dental health, right? So they're scraping off the bad stuff.
Yep.
And then they put in some good stuff, essentially.
Got it.
That's what we're doing with the hydrofacial.
Okay.
We're sucking out all this bad dirt, bacteria, oils,
Dead skin.
exfoliating. And then there's like a dual action to this machine where it can exfoliate, but then it can also push in good product. So now we're delivering your skin in deeper than just the top layer of skin. And we're delivering it with all this healthy, good stuff like hyaluronic acids.
And that's why your makeup goes on like you're a
Smooth and-
supermodel.
Well, especially if you
Yes.
paired it with a dermaplane.
Right.
Oh, yeah.
Oh my God. I have so many questions. Wait, how often do you have to do this facial?
well,
I mean, it
Lindsay's
really-
saying every 6 months, right?
Yeah.
Once every 6 months?
I love a lot of our patients get on board with every 3 months, they do a dermaplane, Hydra, Botox.
Doesn't
That is
hurt.
Boom,
the
you're
best.
done. Yeah.
Dermaplaning and Hydra, absolutely not. And Botox, we use a 33 gauge needle. It doesn't come smaller than that. It's nothing.
And people go every 3 months.
Yeah.
Meredith? for derma. What is it again?
Dermaplane. It's
That's
like
a scraper.
It is.
Yeah.
That's what makes the makeup go on beautifully. It's technically an exfoliation, but it does remove vellus hair. Okay, so makeup goes on like a baby's bum. It's just so lovely. And if you pair it with a Hydra and then your Botox, you're just good to go.
Stephanie's speechless.
Good to go.
I'm speechless.
Doing those two, doing the Hydra before Botox does seem to help prevent, well, pain is definitely better. It's less because you're feeling so good. Your skin is prepped and so clean. The needle goes into the skin easier. And it also prevents bruising. So it's a really nice combination.
That sounds pretty magical.
Not to talk about me again.
Yeah.
But so I do have like some facial paralysis. Is that something that I could get Botox with? That scares me.
From what?
From a virus I had.
Oh, okay.
I had Guillain-Barré syndrome.
Wow.
So I was paralyzed.
Yes.
And it went up to my brain stem. And so I was left with some facial paralysis in my, just like you, I mean, you probably wouldn't be able to see it. And it's been a lot of years now, but it's still not the same as my left side of my face. So what about that?
You can definitely help match people. We've taken care of people who have had that in the past. Also, if someone has Bell's palsy from Lyme, that's why I asked what it was caused by, because then there's also people with MS. So the contraindications with Botox, again, are pregnancy and nursing or an active workup of a neurodegenerative disease like MS. But in someone like you who has paralysis longstanding, you know what it's from. It's not getting worse.
Right.
Yes, we could help your other side match if that's what you wanted. Without like an issue.
Oh.
Yeah. So there you go.
Interesting.
Pretty magical.
The wheels are turning.
So now what can you do for this? Is there anything you can do besides Botox and fillers?
That's probably your greatest question these days,
That is the
right?
greatest question.
Can we
And
put a piece of tape?
so funny enough, we are going to be offering PDO threads in the next few weeks.
Really?
Talk
few
to
weeks.
me. Talk to me
I've
about
watched
this.
the videos.
Have you
of
watched
this.
it?
Yeah.
So PDO threads are essentially like a suture, like if
Just
you got
like
stitches,
tape.
Yeah.
like tape,
Okay.
just underneath the skin, and they're used to take this area without a filler
Yep.
and pull it up, pull it up, pull it up. You're a great candidate because you have really good skin integrity. We're not looking for someone who is very, very long and their skin integrity isn't great, because what's going to happen if I pull? It's going to ripple. We don't want them to ripple. So you want to give a nice lift here. You can give a nice lift here. So next couple of weeks, and that's without a filler, because we do have some people that don't want filler or they can't have filler because of maybe an autoimmune illness or a medication they're on.
Well, that's what I was going to ask. So people that have autoimmune illnesses, they should not be getting filler.
Depends.
Right. There's certain fillers that are safer.
Wait, why? Why? I don't know any of this. Why? What happens if
So-
you have an autoimmune and you do this?
Usually it depends on the medication you're on for that autoimmune.
Oh.
So like if you're on a biologic and that decreases your immune system and I'm putting a foreign body in you.
Like Humira or something like that.
Exactly.
Got it.
Like
Okay.
a Humira, and then I put a filler in, is your body going to tolerate it?
Right.
Or is it going to reject it because it's a foreign body?
Right.
So it depends. Hypothyroidism, I mean, I have hypothyroidism and I have Botox and filler and all the things.
Yeah.
So
I wish I
you
had
know.
hypo.
Same. So thin.
No, you guys wish you had hyper.
Oh, hyper.
Oh,
Okay.
the other one.
I want hyper.
You are hysterical. Yeah, so those are the ones that
being
you be
honest.
careful of.
Yeah.
Right.
And we may start, depending on, like you said, the medication, when did the autoimmune begin?
Yeah.
Is it stabilized? There's so many
So if you have
factors that go into
Right.
that. But there are certain fillers that are safer for somebody who may have an autoimmune.
So when they come
yeah.
in and they say, I have such and such autoimmune and I'm currently fighting against it, you would maybe say, let's hold off on the fillers for now.
Yeah,
or,
I might, depending on what's going on.
Yeah.
Sometimes I've even said, how about you go get clearance from your rheumatologist?
Mm.
And 9 times out of 10, the rheumatologist says, of course. You
Right.
know,
'Cause I
but
feel
we
like the
always check.
Botox is fine. So
Botox
yeah, the
is fine.
Botox is fine, I think,
Yeah.
for that. But
Yeah, the fillers are just made so well. Like Lindsey had said, they've
Yeah.
changed so much in the last decade. They last a long time. And so we want to make sure your body can just handle that.
right. Right.
Yeah.
What happens typically if your body is not handling it is like something called a nodule. So maybe somebody would develop these little bumps, which can also be managed. We've seen that from patients from other practices, you know, and potentially you could dissolve them. I've had a patient I sent off to a dermatologist to have the little bumps all biopsied. And it was just basically calcium, like calcium deposits. But for the most part, that's so rare.
It is.
Like, even with most autoimmune patients given fillers, it's really rare to have that happen.
Very.
So we would just start slow and steady and have them see their rheumatologist first.
Right.
But I wouldn't necessarily say absolutely not. It's,
Right.
yeah, so there's exceptions.
There are. And if they don't want filler, they don't want these PDO threads, we also do microneedling. Have you ever heard of Morpheus?
No.
So Morpheus is like the king or queen of microneedling because it also involves heat. So it's radio frequency. So it's not a laser. So it's safe for any skin tone, even if you're tan. And what happens is we numb your face, or you can do it on body. I think it was made famous in the abdomen by a little Kim K. And what happens is it goes to a certain depth. Morpheus 8 goes to 8 millimeters if necessary. On the face, we're not going that deep. Once the whole face is numbed, you're actually creating these microchannels in the skin at various depths while you're delivering heat with insulated needles. So the external skin doesn't burn, but the skin below the surface is all regenerating collagen.
And what would you do that for?
You do that for sagging skin. You do that for better elasticity, better collagen. You would do that to help everything tighten up. I am having my third one, hopefully, this week. It's a series of 3. And then every year, you want to probably do 1 to maintain.
And what's the prep for that?
My prep is I just don't use a retinol because that makes me a little sensitive to heat. And then I just wash my face, have my numbing on for 40 minutes, and then the esthetician goes over my whole face and neck. Love it for the neck.
That's the one I want to try.
Yeah, love
I've
it for the
been thinking
neck.
about that
I'm
one
so
for a while.
scared to do that, but I want to do it.
Yeah,
that's one I
downtime's
wanna try.
nothing.
Well, because I've
Nothing.
seen a chemical peel
I just don't
too,
want
and
anything
that
to hurt.
scares me.
Chemical
Yeah.
peels have more downtime than microneedling, believe it or not. Your skin isn't peeling off after microneedling. You know, I don't want you to go in the sun after because you do have these micro sort of holes in the skin. Even if you can't see them, they're there. So we usually say avoid travel for like a week or 2 into the sun after a treatment. And the treatments are 3 separated by 4 to 6 weeks.
Oh, okay.
So people do abdomens if they've like lost a lot of weight. I mean, we can talk about semaglutide too, and what brings people in. But with the weight loss and the skin needing better skin turgor, that's really what microneedling does.
I saw that too. So how is that different from the current weight loss, the semaglutide that you mentioned?
So you mean how is it different than the trade names, Ozempic and
Yep.
Wegovy? So
Yep.
it's the active ingredient in those.
Okay.
We use a compounding pharmacy.
And how do you do it? What do you?
So a compounding pharmacy isn't regulated by the FDA. It has
Okay.
their own board of regulation. I don't know if you guys have ever used a compounding pharmacy. They make everything, basically.
I don't even know what you're talking about.
So there's a lot in Massachusetts.
They offer this weight loss program.
Yeah.
That's what it is.
Yep. And so a compounding pharmacy is a pharmacy that compounds medication, and they are regulated by their own regulatory board. So they make semaglutide, which is the active ingredient in name brand Ozempic and Wegovy. So we use semaglutide to assist patients with delayed gastric emptying, which is exactly what name brand drugs are trying to achieve as well. And so with that, you're full quicker for longer periods of time. You could have nausea if you overeat, some constipation occasionally, but the average weight loss is anywhere from 15 to 30 pounds. We've seen a lot more than that as well.
Sign me the hell up.
Usually by 2 to 3 months, I tell people
Yeah.
20 pounds by 3 months is probably average.
Yeah, I've lost 33.
Yeah.
Wow.
So you've been doing it.
Uh-huh.
I've lost 30. We started at the same
Wow.
time.
Mhm.
Yeah.
Yeah.
Yep.
Well, so we had a girlfriend in here. She was taking fen,
Oh.
and she was like, "Yeah, my energy level is off the charts.
It's
and
like
then
she's
by
on cocaine.
8:00, I'm ready to re-roof the house."
Yeah, no, this doesn't affect that at all. If anything, you could get a little tired from it. And that could be because you're deficient in calories, right?
Yeah.
Because you really don't have that much of an appetite.
So it basically just inhibits you from wanting to eat.
It does.
It
does.
creates this satiation that we've all been like begging for.
100%.
So that it shuts off that chatter of, okay, I'm hungry. Let's get breakfast. What am I going to have? I'm going to be hungry really quickly again soon. Those people who think about food all day long, it shuts it off.
Mhm.
you just kind of know what you want to eat, and you eat a little bit and you're all set, and you could be all set for hours and you feel great. So that's a major.
And there's
unbelievable.
probably, I would think, so fasting, we know it's good for the body, right? It's good for the brain. Not necessarily huge amounts of time, but when you take in calories, it can exhaust you. Yes, it can give you a boost, but I would think that there's it's an added benefit because now your body is going through that. You're eating things. You're probably easier to eat things that are healthy because you can plan for it, and now it catapults you into that next step.
Slows it down so we can absorb everything. And Allie doesn't like sugar anymore.
No.
It's not a discipline thing. She just doesn't like it.
It's unbelievable.
Right?
Like on Halloween,
Yeah.
Valentine's Day, my birthday, I didn't have to struggle. Okay, I'm only going to have one. I was like, no, thanks. It's really unbelievable. And you can order something and you just eat a portion of it. It's
Like the skinny people in our lives.
That's exactly what it's like. And I don't know if anyone watched Oprah's special.
I did.
But, right?
Right.
So this conversation about that extra space in your brain that isn't dedicated towards constantly thinking about food.
Yes.
Right.
And that when you're like that, you don't actually know that other people aren't. It's like, oh, wow, they have so much more willpower than me. And it's that self-deprecating behavior,
Yes.
Right.
And I love that she was like, no, not everyone thinks that way.
Right.
And this medication helps you to feel like that.
Ah.
It's really fascinating. It's fascinating. I love it.
Well, bravo for you guys too for trying it.
Mm.
Because you're going to be, patients will come to you for it, and so you can give firsthand experience, which is incredibly valuable.
I think so too. And the long-term studies on this have just been really positive. So yeah, we do consultations for this numerous times throughout a day. And really the only contraindications are neuroendocrine cancer, medullary thyroid cancer. If someone has type 1 diabetes, usually they can qualify. So we send them back to their primary.
Oh, right.
It's because we don't deal with insurance. So it's a wonderful program. And we also have hired a health coach because of how many people are interested in it. And she's helping people with diet and exercise and making sure they get enough protein and calcium. It's really been great.
So I love this about your practice because even looking at the website, it becomes more, rather than just come get your Botox, come get your aesthetics. It is becoming a total body wellness program.
Wellness center.
Thank you for saying
Thank
that.
you.
Yeah, we've worked really hard at kind of really creating that and making it that safe space where people feel like within their community they can come and have full service care.
Yeah, it's awesome.
From your face to your vag.
That's right. So
And
talk
everywhere
to me
in
about
between.
Right.
What
Amazing.
Talk to us about what it's like having 3 facilities.
Should we tell them?
That was a lot of deep breathing. Did you hear that?
Right.
Yeah, we had to center ourselves there.
Yeah. I get it. Stephanie and I are business partners, so we can totally appreciate.
We can relate.
So you must relate to the fact that you are so grateful for a great business partner.
Yes.
Yes.
That is
Yes.
key. I mean, we have incredible communication. We understand each other very well, and you can't have a business together without that.
You
So
can't. The
it's-
mutual respect. I've known Lindsey. We grew up across the street from each other in
Oh, no
Stoughton.
way.
Oh.
We were neighbors.
Mhm.
And, it's just that understanding, that mutual respect, being able to know what she's thinking or what I'm thinking before we say it. And also we have really different strengths and we are able to capitalize on those strengths, right?
So awesome.
Isn't that cool?
It's so much better to have a partner, isn't it?
oh,
Right.
Oh,
so
it's
much better.
So much better.
I could never do this alone.
Yeah.
I wouldn't want
absolutely.
to.
No, same.
I wouldn't
Yeah.
want to.
Yeah.
And with the 3 locations, we do most staff actually rotate and are present in each spa throughout the week at different times.
Oh, cool.
So we are at a different. We're at each spa 2 or 3 times a week.
Yep.
So that's why you needed to
Yeah.
have the scheduler.
Yes.
Got
That's
it.
right.
Okay.
Yeah.
Yeah, that
Yeah.
makes sense.
So we're in a different spot every day.
So she just schedules you guys and you
Mhm.
kind of look at your schedule so you know where you're going to be.
Well, I know, for instance, I'm in Easton today, and I know tomorrow I'm Milton, Wednesday I'm Hingham, Thursday I'm Milton, and I know the rotation,
Okay.
and then the patients fill in.
Got it.
Yeah, so those spots are always open in those spas.
And when do you do your business planning?
In between patients?
All day, afterwards, before bed.
After work, before bed, midnight.
In the middle of the night when you wake up.
Sunday morning at 8
idea.
o'clock.
Right. I have the best idea.
Right, because we each both have 2 children as well who are under the
Same
age of 11.
Yeah.
And so it's busy. It's busy, but that's also what makes it work. We understand that balance too.
Right.
And you're always trying to achieve that balance. And the other way that it works is we have really amazing staff we've surrounded ourselves with. We're really lucky that this is a field so many people want to be in.
Right.
That is where we're very lucky. So the majority of our front desk staff are also nursing students. So
cool.
that's really cool.
Are you hiring?
So depends. What do you have a position in mind?
I don't. But this is my niece's dream come true.
We
She's a
do
nurse.
We've done precepting. We do offer internships. We have a girl from Milton High who's doing an internship this
Yes,
summer.
we partnered with Milton High School for our Milton
No
location.
way.
Oh, nice.
They do a job placement for their seniors, and they had someone
Oh.
interested in nursing, but specifically aesthetics.
Yes.
This is our second year doing that, and it's I think a 52-hour internship,
Wow.
and they're not allowed to pay. They sign all their HIPAA agreements, and they come in and do special projects, and they present it. It's really, really well run. It's
Well, good for you guys
so
because it's a
cool.
lot of work on your end.
It
It's
is.
a great way to give back.
Right.
It is.
Really
It
great
is.
way.
Thanks.
Yeah.
It is. And they're so wonderful just seeing them be so passionate about it, too.
I bet.
Yeah.
It's really cool. Yeah, it's really cool.
We've had a couple interns that wanted it. We were like,
We don't because you need a.
It's
My feeling was you need a program,
Right, we don't have a
I can't just
program.
create an intern,
Right.
take an intern on. We need a structured program.
Absolutely.
And our world is just so erratic that we didn't really have a place
No,
to
it
come
is.
to. Yeah,
That makes sense. And
Yeah.
at least the nursing students we precept, you're really just offering them the opportunity to shadow you.
yes,
Right.
Right?
Yeah.
Right.
Yeah, they
Yeah.
have their curriculum.
right,
Right.
right.
Yeah. Yeah. So that part's pretty cool. But yes, all the offices.
Do you have any men that work for you, or is it all women?
We don't have any men, not because we're averse to it.
Yeah,
You know?
it seems
No one's
a
applied for the job.
female-dominated
Mm.
industry.
Yeah, it really does. You know, I mean, we were lucky enough to be part of Lisa's book club, Lisa Donovan with Kiss 108, and we were on a panel with a male surgeon.
Oh,
So
no way.
that was really cool.
Oh.
Right.
Dr. Sean Doherty, and that was wonderful to sit there and kind of talk with him, and they asked us all questions, and I thought that was really cool because you were getting not only a surgeon's perspective, but a male's perspective.
Right.
You know, on
Right.
the questions
Right.
people were asking. So yeah, and maybe a male feels comfortable going to a male. I'm not sure.
Right.
You know? Yeah.
I don't think I've
No.
ever met a male injector. Have you guys?
We know. Yeah,
we know a
few.
couple. A couple.
There's H2T
Mhm.
is owned by a male RN, NP.
NP, yeah.
Yeah.
Yeah. Yeah. So
He's
there's a
great.
few male injectors that I know of. Not definitely predominantly female, but
And do they market specifically to men?
not that I've seen.
Huh.
Not that I've seen. Yeah. But the same reason maybe a female would feel more comfortable coming to me
Yeah.
for the O shot.
Right.
Maybe
Right.
a male would feel more comfortable going to a male for male pattern balding or something
Yeah.
like
Right.
that.
Yeah.
Who knows?
You
right?
never know.
You never know. You never
an
know.
individual decision.
Yeah.
But that whole industry for men, a friend of mine started a men's grooming product company, and it seems like there's a big space for growth there,
I
especially
think
with
so.
the young guys who
Huge.
are loving it, right?
I think
Oh,
so
yeah.
too. Yeah. And our males who do come in for aesthetics do tend to be younger. You know, I think it's a different generation.
Almost like there was a stigma.
I think so. And like when we go to these conferences and they compare data from the US and data from Europe, the male uptake of aesthetics in Europe is so much higher. I don't know
bet.
that surprises
Yeah.
us. You know what I
Right.
mean?
Right.
It's so much more accepted.
Right.
You know, everyone wants to look good.
Right.
Would you say we have a lot of men in our semaglutide program?
Definitely. So I was going to say
Oh,
that.
Yeah,
Interesting.
a
You
lot.
know?
They don't hesitate to come in for that. And we've got men who are bringing in their sons.
Yeah.
And they come in and they do multivitamin injections and they sit and have IVs
Yes.
together. And so
That's been great.
that's been great.
Mhm.
So I think that
Interesting.
it's
There's
happening.
So
it's
many
happening.
products.
Yeah.
My head is spinning.
Well, this is the thing. Sometimes you just want to find out what's
Yeah.
out there, what's new,
Right.
and not having a full idea of what does what in a conversation like this, how these products work,
Mm.
and how does an injector influence how the work is done, right? All of
That's
this.
huge. I
It
mean,
is
it's a
huge.
style. There's different styles of aesthetics, right?
There really are.
And our style is the same, Allie and I, and our patients are similar. And everybody that we see, like Allie said earlier, they want to come in and leave looking like themselves.
Yeah.
They just want to feel and look maybe a little better or prevent certain things from happening. But that's what we love to do. We love people to feel healthy and look healthy. We don't want anyone to look crazy.
Yeah.
What did they say about the overfilled patients? They come in and they're so scared to look puffy, they say. Usually our patients are not looking like that unless they want to.
Well, don't you feel like that's part of kind of where we are in the country too? New Englanders.
Oh, absolutely.
Sturdy New
Absolutely.
Englander,
Yeah.
as I've been called.
Oh, definitely. Yeah, there's a look to a New Englander, and a lot of it is
Right.
not natural,
Right.
right?
Yeah.
So I definitely think your practice kind of follows, right, where you live, and the people you take care of tend to kind of gravitate towards that, right? I mean, Lindsey and I'm very open sharing what I've done, but hopefully you wouldn't think I had done half
Yeah.
of what I told you, right?
Right.
So that's the goal, is that you can do things without looking done.
You're speechless over there.
I'm
It's
trying to-
very rare that she is.
I'm trying to figure out what she's had done.
I mean, last week or this year?
No lines. I know.
Yeah.
Always good to have a partner.
You are a model for your business,
We
right?
treat each other for the most part.
Mhm,
But
absolutely.
we'll also, if we hire a new nurse, we let them practice on us.
Oh, definitely.
I've had the low eyebrow for a few months. I've had a crooked face before.
And that's the fun thing. We can laugh about this, but Botox goes away.
Yeah.
Right?
Yeah.
So, like, if someone doesn't love it,
Yeah.
everyone does. But if someone
Right.
doesn't love it,
Yeah.
it's gone.
Right.
You know, in
Yeah, it's
90
easy.
days.
Yeah.
It's like a hair color you try.
So do you need to have different Botox type products?
we do.
Yeah. Do you have to
Yeah.
switch because your body can get used to it?
Great question. There's a lot of theories on that. We switch people all the time. I switch all the time. We usually at our practice, we have Botox, we have Dysport, and we have Xeomin. There's more FDA approved for cosmetic use. Those are the three we carry.
Okay.
Some of the reasons are they have really excellent reward programs, and we offer all the reward programs.
Oh, got
so
it.
sometimes people will switch because, I don't want my body to get used to it, but also because then they can go from one to the other and use different reward programs because
Got
we
it.
offer all of them. So that's really nice. I use all of them as well. Some work better for certain people, definitely.
Just how your body
Just
reacts
how
to
you're
it.
made, how your body reacts, exactly. They all have different manufacturers, so there might be a little something different about each of them, but they're roughly all very similar. Yeah.
Yeah.
So, like right now, if you try Xeomin, there's a $50 off promotion
Mhm.
through the company that makes Xeomin.
Oh.
So that might be something that will get somebody to try. Like if they're just kind of on the edge of doing the right dose, they can't quite afford it. We'll say,
Give it a whirl.
Yeah, we'll
Save
say let's
$50.
try. Yeah.
Exactly. Save $50,
That's important. I'm going to give a anecdote that is not similar, but it kind of is. When you have your practice all in order like you do, and you have the points that you know are important to people, right? I recently started using the Shaw's app.
Mhm.
I never shopped at Shaw's. My girlfriend turned me on to the Shaw's app because it made my life easier. I can get coupons that I couldn't access because I can't clip. I don't have time to do all this and that. And I'd get $10 off of 50, or it just would make my life easier. I can come in and I can get everything done, show up. And it sounds like that's kind of what it's like where you guys are at.
Absolutely.
You've already indicated when you come, you can do the hydrofacial, which is good. You can get your Botox, you can get, and an IV all at the same time. So that time is so important to us, right? And the fact that we can go to you and you can say, Meredith, have you heard about this product? Think about it in the future. There's a discount if you want to try it. Maybe this is something you want, because I don't know what the products are, but you guys are on the cusp of it. And we need someone in our lives to be able to say, this is what you might want. I mean, we offer that to our clients. Like, keep me in mind, if you're going to do a project in your house, let me know what you're doing. And I'm going to tell you, this is valuable. This isn't, right? Like, you need someone, what is it? Joe says you have an attorney, you have an accountant, you need to have a realtor. And what would you call your title of what you do? I mean, I call it an injector, but I don't know.
You can call us an injector.
Yeah.
An aesthetic NP, an injector.
That you need that person in your life who says, this is coming down the pipeline. The threads might be something that might solve the problem that you've seen yourself having.
I think so too. And knowing that client and being able to know that they trust you, give them some information.
Yeah.
You know, and I just speaking on how it has to be easy. We've all gone into CVS. Oh my God, if they give me one more long receipt, I'm going to just, I don't know.
Yeah.
It's awful.
Yeah.
It's a waste of the
You
environment
can't-
and I can't stand it and I don't use them.
Yeah, correct.
So with Allergan, who is the rewards program for Botox, Juvederm, Kybella, everything that they offer, they have an app that has made everything so easy. You can literally scan when you walk in and it'll do a flash sale. They figure out exactly where you are in the world, what you've done in the past, what you might need. And then they usually give you a coupon for it. And you can use it only for the next 12 hours. So they have done all the marketing.
Yours would say probably discount on filler because you've been talking about it. They're probably listening to
I'm scared.
So true.
She'd get the $500 one.
Right?
We've seen 3 $500 ones, and people are like, wow.
Wow.
They're about to walk out the door when they hear about fillers, and then they're like, well,
Fine.
500, let's go.
Let's do it.
Like, you can dissolve it, right? I'm like,
Shoot me up.
So funny.
Yeah.
So the ease of it has to be there, right?
It has to be.
Yeah, and they recognized that they'll give you points on everything.
Because
no matter
people
what you
love
do.
points.
People love points.
My girlfriend loves slot machines. There's and my kids love video games, right? People love points. It's just a thing.
So the patient who comes in and gets Botox, we can give and gets everything else that you were saying. We can actually give them points for their IV, their B12, their dermaplane,
Their Hydra.
their Hydra. So we can click all those things, and they're getting points of dollar value that goes into their Alley account.
There you go.
Yeah, it's
I
really
get-
amazing.
Starbucks is on that too. Starbucks has me hook, line, and sinker. I am in.
You're pretty easy.
I am so easy with the points, and I accumulate them. And then I went like, "Can I use some of my points?" And the girl said, "Oh, you need to use some of those." But I had 1,200 points
Amazing.
for Starbucks. But we love that.
Love
right?
them. Love them. That's how I fly.
Yeah.
Always points.
How you fly?
Oh my
Right.
God.
Yes.
Points.
Right.
Points.
Yes.
Never pay for a
Points.
flight.
Yes.
Right.
Yeah. So good for you guys for getting that all figured out. What people want, and your 3
Thank you.
locations, and your amazing staff, and the people that you work with. It's exciting to see your success. It
Thank
really
you.
is.
Thank
It
you
really
so
is.
much.
Yeah.
Great to
Thank
feel
you.
supported by your community. So
Oh,
thanks for
yeah.
having us.
Yeah.
My
Secret
head is-
community.
My head is spinning. The secret. I would be telling
See,
everybody
the
what I
silent
get.
majority.
I would be running into the office and saying everything.
Yeah.
There is no secret with me.
No, I mean, I think it's wonderful. I really do. It's awesome stuff, and you make people feel better about themselves. Nothing better than that.
Nothing better than that. Feels
Yeah.
good.
Well, thanks for joining us, ladies.
Thanks for having
Thank
us.
you
Hopefully
so
you'll come
much.
back.
I have
Thank you.
learned
We'd love to.
so much.
Yeah.
I'm mentally exhausted. This was a lot for my brain.
Might need a nap.
It's a lot
I will
of
be
information.
taking
You
to the
might
bed.
need an IV.
Yeah, there you go.
I probably do.
You can get points, Steph.
There you go.
That's right.
Thanks,
Awesome.
girls. It was so nice meeting you.
Well, thank you, ladies.
Thank you for
too.
coming.
Thanks for having
All
us.
right, take care.